educate, celebrate, connect. Arizona Hispanic Connection.
Welcome to AARP Arizona Hispanic Connection. We have a very important show today, and it is called Coronavirus General Information, March 24th, 2020. Para los que hablan español, soy David Parra. Estamos en su programa AARP Arizona Hispanic Connection. Tendremos 30 minutos en inglés, seguidos por 30 minutos en español. A la media hora, 1:30, seguiremos en español. Únase a nuestro programa. Again, this is AARP Arizona Hispanic Connection. I want to remind you that if you do Facebook, go to our Facebook page at AARP Arizona Hispanic Connection and follow our page and share it with friends and family. We have two special guests today to address or help us to address this matter of the coronavirus General Information 32420. Before I introduce them, let me read a little paragraph that I wrote here for this show. Today's topic is very unique. Unique in that in a very short while, it changed our way of life. Our country and the whole world, for that matter, is in a state of fear and uncertainty, a very unusual experience. We are talking about the coronavirus. And again, we have two special guests today that will help us understand basic information about this important topic. And let me introduce them right now. To my left is Paulette Rangel. Paulette Rangel is a registered nurse, and obviously she works, I understand, for a hospital, but she's here representing the National Association of Hispanic Nurses. Paulette, thank you and welcome to our show.
Thank you so much for having us.
A very difficult topic, I suppose, and you're there. You work for, I believe, St. Joseph's, and
Yes.
I'm sure that you have good information for us as to what you are seeing at the hospital level.
That's right.
Thank you again. And to my right, we have Felipe Santoyo Cuellar. Felipe Santoyo Cuellar is also a registered nurse, and he also works actually not for a hospital, but for a clinic. But he's here again representing the National Association of Hispanic Nurses, Phoenix chapter, once the #1 chapter in the country. Now I understand it's only in second place, which is not very close still to first. So Felipe, thank you so much and welcome to our show.
Thank you so much for having us.
Yes, and I'm going to ask you to speak, with a strong voice
Sure.
so that everybody listens to you. I'm sure that it'll be fine. I'm going to throw at you, if you will, a series of questions that are basic questions, so that we can help ourselves and the audience who joins our program to understand better this situation. Right? We know it's the coronavirus, el virus corona. They also call it the COVID-19. COVID-19. So let me come to you, Paulette. You are actually the president of Chapter 1, right?
I am. Yes.
Good. What is the coronavirus?
So the coronavirus is a new strain of coronaviruses. So we do have other coronaviruses that are not the new one that we've been experiencing as of late. So the coronavirus started in China. It emerged from China back as early as December that we have seen. The exact source has yet to be identified, but basically coronavirus is one of the strains, or COVID-19 is one of the strains that we've been seeing.
Now, could you just briefly tell us what is the difference between the coronavirus and what we have known as the flu?
Sure. The coronavirus stems from SARS, okay, so which is different from the influenza virus.
Okay.
So there are two different kinds of viruses, although they present somewhat similar for as far as symptoms, but they are two different types of virus strains, and they are treated a little bit differently.
Now, you work for a hospital. What have you seen? Any load of cases? Is kind of balanced? What have you seen at the hospital level? I understand you work at ICU
Yes.
unit. What have you seen there in your unit where you work?
So far, we haven't had any positive cases. We have seen people that what we call rule outs, which is people that may be presenting with similar symptoms that we might think could be coronavirus or COVID-19, and we may or may not have tested them. And so at that point, we're just waiting for them to get results.
So what happens when somebody gets the virus, right? And they feel that they need to go to the hospital. They go to the hospital and they are actually diagnosed as positive. What usually happens with the patient that has been diagnosed as having the virus?
So they may or may not need to go to the hospital. It just
Okay.
depends on the symptoms that they have. So if the symptoms that they have are serious enough to require hospital assistance, then we would recommend for them to go. But not everybody who gets COVID-19 requires the hospital. A lot of people can recover at home.
So and let me come back to you, Felipe, because I believe this is very important. So because people might think that, oh, I got the virus, I got the symptoms, oh my God, I'm gonna have to go to the hospital and they're gonna keep me there. Is that really the case, or it depends on the situation?
It's very situational. I think if you have the mild symptoms, it's best for you to stay home and recover at home. Evidence-based shows that no matter what you have, it's usually the best option to stay at home and to treat yourself. I know a lot of facilities and hospitals, clinics throughout are offering telemedicine now. So they're able to still stay in communication with health professionals. But definitely it's better to just stay at home if possible. If you do have persistent issues that require more severe treatment, then you will be triaged and most likely admitted into a hospital.
I'm going to ask you, Felipe, about the symptoms, right? But let me put myself as an example. I'm here. I think I'm doing fine. I go home and eventually start feeling the symptoms, and so you're saying that I can stay home. At what point, if I do stay home and I get worse, what's gonna be what am I gonna be feeling that should trigger going to see a medical professional?
So that's a great question. So if you start to feel any chest pain, if you start to feel very short of breath with some of the smallest movements, such as maybe getting up to use the restroom and you're feeling so out of breath, you can't really, contain it. If you start to have a fever that starts breaking 102 or higher, any of those will definitely require you to start seeking some medical help.
Otherwise, I just kind of go through it in a sense as if it was just the flu, right? Liquids, just over-the-counter medicine. I mean, what typically would I do if I decide to stay home?
If you decide to stay home, definitely some rest. Like you said, some fluids, stay really hydrated, continue eating, have a nutritious diet. And if you wanted to take some medications, Tylenol is definitely recommended to kind of help keep that fever down.
Right.
So I think those would be one of the more important things.
Pay attention to fever, I suppose, because typically this is very typical of the flu, right? You get fever,
Yes.
and then you get some bone aches to some degree.
Correct.
And that should be considered normal. That shouldn't trigger a visit to the hospital necessarily at this point.
Correct, because the body aches can relate to other things such as allergies or the flu. But of course, if you start to have things that are limiting your everyday activities, then definitely seek treatment afterwards.
And now let me, ask the question about symptoms. So what are the symptoms of the coronavirus that may be different than the normal influenza, right?
So the top three main symptoms for coronavirus right now is the shortness of breath, the fever, typically 100.4 degrees Fahrenheit or 38 degrees Celsius, and the cough.
And usually it's described as a dry cough.
Correct.
Okay.
Yeah.
So, but again, I may have that, it could be very likely that I have the virus, but that still shouldn't trigger a visit yet.
No.
Okay. So you're saying that the body can potentially overcome that,
Correct.
and it should, as the flu typically happens.
Yes.
Okay. And again, let me just clarify this because, but let me come back to you, Paulette, because I think off the air you mentioned what is the concern? I gather there are two very important points why there is the concern and the need to stop the spread.
Yes.
One, obviously, we don't want people, to get sick, but there's one element that you mentioned that I think is very important. Can you highlight that?
Sure.
Element.
So the reason that we're telling everybody to quarantine themselves, to practice social distancing, it, like you said, it's 2 points. Number one, we want to slow the spread. If you start to have symptoms, we don't want you to be out in the community potentially spreading it to other people. And they have said that there are some COVID-19 cases where you are infected, but you may not be exhibiting symptoms as of yet, but you could be potentially spreading it to others. So that's one point. We don't want that to be spread out to other people in the community. Number two is we want to, what they've been calling is, what's the curve thing? Is to slow the curve, right?
To slow it.
Yes.
Not flatten it.
Flatten the curve.
Okay,
Yes, you're right. You got,
Wow.
yes, thank you.
I've been watching the news too.
Yes. So we want to what we call flattening the curve, okay? And so that means is we don't want, if we were to continue our lives the way that we have been, going to work, going to school, going shopping or traveling, then those numbers that we see in the country and in Arizona would be exponentially higher than they are right now.
Okay.
And so that would be putting a lot of stress in our hospital system. And we at this point we don't have enough supplies. We don't have for the amount of people that would have gotten sick, we just the hospital systems would just not be able to take care of that many people.
So basically, two things: the concern that too many people would catch the virus,
Yes.
and then would end up potentially in the hospital, and we don't have the capacity
Correct.
to take care of so many people.
Yes.
If that was to happen.
Yes.
That's very important. I think very important point. Felipe, we know that there is no vaccine, right, to prevent the coronavirus, and they're working on that, and
Yes.
we are hearing a lot of stuff about that. Hopefully they'll find one, right? So but are tests available? I mean, are there tests that can be performed to see if a person has the virus or not, and also where and how?
So there are tests available. The tests are limited at this point. So that's why the triage portion is very important, making sure that your symptoms correlate more with the coronavirus to ensure that we are using these tests to the best of their ability and manage carefully. There are some places that are now offering drive-throughs, on-site tests. However, these places do require that you do have a prior physician order because we want to make sure that, again, we're using these tests when necessary to ensure that we're truly capturing those that do have the disease. Many hospitals around the valley, such as Banner Health, Mayo Clinic Hospital, are some of the hospitals right now that are doing that, those drive-throughs. But I know if you're able to kind of contact the Arizona COVID-19 hotline at 211, you're able to get more information to see what would be the closest center for you to get tested.
Is that a good number that people should remember? It's almost like the 911, but this is in Arizona, 211 for pretty much any need.
Correct.
Okay, and then they would be directed to whatever department or area that could take care of their needs. Correct.
That is correct, and they also offer those services not only in English but in Spanish as well.
Good. Okay, so let's move on. Now, the matter of getting tested, I'm not sure. I haven't heard. I don't know if you have heard anything about whether it's an automatic that insurance will pay for it. I understand that that President Trump signed a bill that provided some funding to pay for tests when a person needs it and has no money to pay for it. I think it's accurate in one of the two bills that have been signed. But what about this testing? So I suppose the people have to ask their insurance companies to see if they cover it, and if not, they would have to pay it out of pocket.
I don't know the answer to that, to if they're going to pay out of pocket, but definitely reach out to your insurance companies. You could most definitely call them and see if that's something that's covered. Now, like you said, I have heard President Trump say that anybody who needs a test, that they would cover the cost. As far as whether it's trickled down to the community, if the state of Arizona has worked through those kinks to figure that out and how that's going to occur, I don't know if that's happened yet.
Got it. But I think it's so critical, based on just my observation and my feeling the mood and comments that I hear in the community, to understand that just because somebody thinks they have the virus, and even if they do, the first thought should be to stay home, and only if they see those other symptoms consider. Would number one be contacting their doctor primary? That
Yeah.
would be the number one. Not go to the emergency from the get-go, right?
Right.
Okay.
So what we are recommending is, if you feel like you have the symptoms, reach out to your primary care provider first, over the phone. We don't want you to go to the doctor and potentially spread, if you do have it, potentially spread it to others, in the waiting room, or to the healthcare professionals that would be, taking you in.
Right.
So what we ask is that you call them. They would be asking you a series of questions over the phone to figure out if you would be a candidate for testing, or even for you to come in.
And sometimes, is it my understanding correct that sometimes they even can go to your house to do the testing?
I haven't heard of any services, but that is a possibility.
Yeah.
Yes.
I thought I heard something about that. Okay, before I ask my last couple questions, I would like to also say a few things that I consider very, very important, and that is the taxes, right? The deadline to file taxes has been extended to July 15. That is a very, very important. In the beginning, it was only the payment. If you owed money, you had until July 15 to pay it, but you still had to file. But now it's filing and making the payments if you owe money. The new deadline is July 15. The Census 2020 also changed the date of completion of, or they call it the self-response, right? The self-response you have now until August 15. We know that Arizona, our governor, Doug Ducey, declared Arizona the state of health emergency, which basically means that there's more, a better, I guess, a way to tap into funding for this emergency. We understand the schools are closed. Some dates they use April.
I think it's April 10th.
April 10th. Obviously, that is fluid. We have to keep ourselves informed. Also, I think it was yesterday. Today is the 24th, by the way. Governor Ducey again declared that bars, restaurants, gyms, museums, public libraries should close, and that only it's a takeout for food. Takeout food is but what is being encouraged. So all these kinds of things are happening in our state. But I really appreciate our two guests today, because I think you are putting things under a good perspective. Yes, we have to be careful, but we should not panic. Is that a fair message to convey?
Yes, absolutely. We don't want people to be scared, you know, and it is a scary time, but we definitely don't want you to panic and go out and potentially spread, something that you might have.
Right. And obviously, many people are going to lose their jobs, and actually they have lost jobs, and that's going to bring in other issues. Perhaps we might address some of those in other programs. What kind of help is available for them? Then you have the medical leave, or when you leave, when you have to, go home, and then what do you do if the company doesn't offer paid sick leave and all that kind of good stuff? So there's a lot of moving parts to this, and so we have to stay informed. But again, the most important thing is to listen to the guidelines, follow them, and don't panic. I think that's I'm getting that message from you, and thank you so very much. Before we finish the program, I still have a couple more questions to ask you. Let me ask you, Felipe, one, and then I'll come back to Paulette. And the question is, I have it right on the first page. Let me go back. How do we prevent it? How do we prevent the coronavirus?
So the biggest thing right now is to wash your hands. Definitely wash your hands with soap and I would say lukewarm water for about 20 seconds. Go through the fingers, go through the wrists. That social distancing, keeping about 6 feet away from people. Try to avoid groups of more than 10. And definitely, just try and be more self-conscious on when you're coughing, when you're sneezing, use a disposable tissue. You can use the inner corner of your elbow, but just be more cautious about that. And to wash hands. That's definitely one of the most important things, and just stay away from large groups.
Same question. How do we prevent it? Social distancing. Can you elaborate just a little bit more on that?
So social distancing to me means staying at home with your family, right? And so not inviting people over to your house to have dinner. That's something that we do not recommend. That's not social distancing. As a matter of fact, I had to tell my dad the other day. I have a 1-year-old, and I had to tell him he couldn't come over to the house.
Wow. Wow.
Because
that's difficult.
I mean, he's still working out there, and he doesn't know what I've been exposed to. I don't know what he's been exposed to, and so those are the kinds of things that we're telling people, to do, is to stay home, and this means don't go, with your friends, to no play dates, anything like that, no parties.
Right. Let's conclude. We have about a minute. What would be, the two of you, what would be your last words of encouragement, information that you want to convey to the community before we end the show today?
I would say wash your hands, stay at home with your family, and please do not panic or panic buy. There are a lot of vulnerable individuals out there, such as those with chronic illnesses, the HIV, AIDS, transplants, COPD, asthma, a variety of people who are truly, could be impacted severely. So, even though you might think this might not happen to you or to someone just be cautious about the community. There are others out there that, this could definitely impact harshly. So just be more conscious and take care and be safe.
Paulette?
And just to go off of what Felipe said, older adults that are 65 and older are also at risk, and especially those that live in long-term care facilities. And just to keep in mind that even though you may not be in the list of those high risk, we're seeing people that are 20 to 40 years old also have complications from this, and so just because you're not at risk doesn't mean you're not going to get it and that you're not going to spread it to others. So always be safe, stay home, practice social distancing, and call your healthcare provider if you have any doubts.
Perfect. Paulette Rangel, Felipe Santoyo Cuellar, thank you so very much for joining our show. Stay tuned. We are going to do the Spanish show now. And last but not least, if you visit aarp.org/coronavirus or www.aarp.org/el coronavirus, you can find a lot of information. Take care. We'll be back for the Spanish show. Have a great day.
Escucha Transformando Vidas.